Dr. Walker, it is indeed an honor and a pleasure to interview you today, especially since I admire you so much. You have been always good listener and a honest advisor. I recall that during the difficult time after I had just arrived to Johns Hopkins, you always took time to listen and to give me thoughtful advice. I'd like to have this good opportunity to ask you some questions. And the first question I have is, it has been said that you are the first surgeon to set up a neurosurgical training program at Hopkins. And you also emphasize all with this training program the importance of basic science in training of a neurosurgeon. I think maybe this is some reflection of your earlier time of when you are struggling to become brain surgeon yourself. Could you tell me some about what's part of basic science influenced you, or what's thinking behind of this?
Well, there were a number of factors that played a part in that decision. In the first place, that was just about the time that the American Board of Neurological Surgery was being set up. And the first examination that was held was quite revealing. I was one of the candidates, and there were about 20 others. The training programs in the different parts of the country were quite different. In some cases, the emphasis was upon clinical neurosurgery. In others, there was a broader base, and the basic sciences, and clinical neurology was included. But the American Board of Neurological Surgeons thought that a neurosurgeon ought to be acquainted with all aspects of neurology and neurosurgery that he might encounter. And so the examiners on that occasion asked questions regarding clinical neurology, neuropathology, X-ray diagnosis, and so forth. And there were a few candidates whose training had been almost exclusively clinical and who had had a superb operative record, who just didn't know the basic anatomy or the basic physiology. So it seemed to me that it was necessary in training a candidate for neurosurgery that he have a broad basis in the field of the nervous system, which would include some knowledge of electroencephalography, a little knowledge of psychiatry as applied to neurosurgery, because occasionally cases are seen by the neurosurgeon that probably are psychiatric and should not be operated upon. And the other specialties that help the neurosurgeon in his work.
I see. I think you have a tremendous depth into the anatomy, to physiology, and also I'd like to hear some related to this. You had found or explored of the epileptogenicity of penicillin in the earlier day in Chicago. Could you tell in this time?
Oh yes, that was really serendipity. Dr. Johnson and I were interested in epilepsy at that time, and one day he came in and told me that he had a patient on whom he had just seen a fit. This patient was a 10-year-old boy who had presumably a medulloblastoma of the cerebellum, and they had given the lad penicillin because he had gotten infected, and a small amount had been given intraventricularly. And within a very short time he had a fit. So we immediately thought that this might be the result of the penicillin. It was known that sulfonamides, another antibiotic, would give rise to cortical seizures. And that led to a rather long program on the effect of penicillin on the cerebral cortex. This was when penicillin was just coming in. And we got our penicillin on a high priority so that we could study these things. And we determined that there were certain parts of the cerebral cortex that were quite susceptible to the application of penicillin, and that these would produce a seizure.
I think that this kind of thing is a really good example that you are not just a clinician. Of course, you are an excellent clinician to treat meningitis, penicillin, but you have another step to it, another level higher, that is to explore that one question came up from penicillin for the epileptogenicity. And then now today, many this research use that methodology.
Yes, I think the clinician always has an opportunity to explore more basic considerations from a clinical problem.
That relating, sort of expand on this question, that what personalities, if you have, or influences that direct you, oriented to you to be such a scientific thinker in earlier day, that's when you started, or if anything, personality influence to you, you're developing all these things?
Well, I was really very fortunate in going to the University of Chicago clinics for my neurosurgical and neurological training, because at the University of Chicago there were a number of outstanding personalities, people that left a very marked impression upon me. For example, we had the physiologist Ralph Gerard, who had done exceptional work on the mechanisms of transmission of the nerve impulse in animals. Dr. Gerard attended some of our conferences, and it was always a pleasure to hear him discuss a patient and to explain some of the physiological aspects of the case, which otherwise we would not have paid any attention to. These conferences were held about once a month, and at them were other outstanding individuals. One was Stephen Polyak. I had the pleasure of working with Dr. Polyak my first year at the University of Chicago. Dr. Polyak was a chap from Yugoslavia who had been picked up, conscripted in the World War, and spent 4 years in the Army, as he said, putting on bandages, a few other odds and ends, but not learning any medicine. And he graduated shortly after that, then got a Rockefeller Fellowship to come to this country to work in California. He worked there for a year on the visual system. He was interested in the neuroanatomical substrate of vision. He was to go back, but unfortunately Europe at that time was in a really great depression, and he couldn't go back. It so happened that Dr. Bailey at the University of Chicago was looking for someone in anatomy who would complement his clinicians. And so he offered Dr. Polyak a position there, and Dr. Polyak came over in 1928 or 9 to work with Dr. Bailey and Dr. Grinker, and as I say, was my first mentor. Dr. Polyak was an interesting person. He had some training in neurology, but not a great deal. His neurological examinations were rather crude. I can recall when I first had him go over a patient with me that we were to do the sensory examination, and I had found certain things, and Dr. Polyak was verifying these, and he pulled out his handkerchief and he pushed up one corner and had a little fit, and he started, "Do you feel this? Do you feel this?" And that was his sensory examination. He did most of his work on the visual system of the monkey, because he thought that the monkey would be much nearer man than the carnivore or any other animal. And consequently, I would help him with the operations, which were interesting to see as well, because he had had no neurosurgical training. He had a boiler in which he put all his instruments, poured some water on, and then put them over a flame. And when the water boiled, why, they were sterilized. And then he would, I think he used some type of epilator to get the monkey's hair off of the head. And then he put his drapes on and made a vertical incision, turned down, and then roundured away the area that he was interested in, which he was going to make his lesion. Made a cut blindly, and then closed everything up. Well, fortunately, his animals seemed to do all right. They didn't get infected. And then he would do a marquee preparation and study the animal in great detail. The lesions were rather haphazard, but he made use of every one of them and got quite interesting results. Dr. Polyak later on published a book on the retina, which is a classic. As a matter of fact, he died before it was actually published, and Heinrich Klever took over and finished it for him and published it. But Dr. Polyak was a very interesting man from my standpoint, that he gave me an opportunity to see what things were like in Europe. But I mentioned Heinrich Klever. Dr. Klever is another very interesting chap. And Dr. Klever was interested in the effects of certain drugs on the nervous system. And so he decided, in order to find out, that he would have to be the experimental animal. And so he took muscarine to determine just what the effects of that would be. And then wrote a number of papers on the subject. This happens to be one of the articles that he wrote that he gave me with regard to that. Well, we had another very interesting basic scientist in the department, Dr. Ward Halstead. Ward was a psychologist and interested in the nervous system and in techniques by which he could determine defects in the mental functioning of a patient. And he devised what he called category tests that he would apply to the patient. If the individual could determine in which category certain objects fell, then it gave Dr. Halstead an idea as to just what his thinking was. These became known as the the category tests, and have been used a great deal. Ralph Reitan, for example, elaborated upon them later. Dr. Halstead was another very interesting person at the University of Chicago. He was a tennis enthusiast, and we used to have a lot of fun playing tennis there. But his main love was in the laboratory with his psychological testing. We had some other interesting people at the University of Chicago. In 1931, Dr. Busey, at the instigation of Dr. Bailey, induced one of the house officers from Queen Square to come to the University of Chicago to join the neurology department. Dr. Grinker was in charge of neurology, but this young man, Douglas Buchanan, came over about 1932 and was to work with Dr. Busey on muscle disorders, particularly in children.
Mm-hmm.
Well, things at that time became a little bit difficult at Chicago. The desire to formulate a neurological institute at Chicago was not received favorably by some of the people, and particularly the president of the university, Robert Hutchins, did not think that there should be such institutes within the university. And the professor of surgery was not very keen on having neurology, neurosurgery, and neuroanatomy taken out of his domain. So that when Dr. Buchanan came over, he was not able to go into adult neurology, but the professor of pediatrics, Dr. Schultz, took him on.
Mm-hmm.
He had a joint appointment in neurology and in the pediatrics. And he saw all the pediatric cases.
Mm-hmm.
Really, he was the first neuropediatrician in the country. Chicago had another children's hospital, but Bob's Roberts at the University of Chicago got many of them. And as Dr. Buchanan became more skilled in the diagnosis of children's disease, all of the interesting cases came over to him. I always enjoyed going around with him. He would look at the squalling infant and talk to the mother for a little bit, and then feel the limb, move the infant around a bit, and then come up with really a very brilliant diagnosis. Dr. Buchanan, in that way, was a tremendous asset to the University of Chicago. Well, those were some of the personalities that I saw while I was there, and which influenced me a great deal.
I see. I'm getting more understanding how you develop this particular yourself. And also, a little bit, I'd like to expand on that. I see when you were in Chicago in 1930s, that there's so many influential personalities there. But before you came to University of Chicago, do you have, someone recommend you to go to University of Chicago because of Bailey or Pollack or anything particular reason, have a special reason you to seek into the University of Chicago that time? Or that's,
no,
if you could believe.
I had not had acquaintance with neurologists or neurosurgeons prior to going to Chicago. Chicago was my first real acquaintance with neurological sciences.
Right. Well, you also spent with Fulton's at Yale, and also you spent with Brewer in the Amsterdam, and also Bremer in Brussels. Why you selected these men after you have an excellent sort of a comprehensive experience in Chicago, and then you extended. What the reason you selected these 3 men, and what your experience at their departments in that time?
Well, the training program at the University of Chicago, as Dr. Bailey had outlined it, was for 3 years. 1 year in basic sciences, which I spent with Dr. Polyak, and at the same time with Dr. Grinker, because at that time he was writing his textbook on neurology. And so he allowed me to go over his proofs and manuscript, correct typographical errors and whatnot, and gave me an opportunity to get acquainted with neurology in general. And the 2nd year I spent with Dr. Grinker, and the 3rd year with Dr. Bailey. But at the University of Chicago, in the training program, the opportunity to do independent surgery was very little. In fact, I think during the entire year I may have opened 1 cranium and perhaps 1 back. I think that was all. So that it seemed desirable that I should get some practical experience. And just so happened that at the University of Iowa, at Iowa City, the neurosurgeon who had finished their residency training course was going to Montreal to get some training with Penfield. His only previous training had been at Iowa. There was no neurosurgeon there, so that they thought that he ought to have training with someone who was a recognized neurosurgeon. And so they wanted someone to fill in for that year. Well, I was quite eager to do so, because this would give me an opportunity to do some operative neurosurgery, and consequently I went out there after finishing at Chicago for that year, and had a very fascinating year. We had an excellent cohort of neurologists. Dr. Van Epps was the chief, Dr. Saaz was the assistant, and he had 2 or 3 other men working with him who were really superb neurologists. So that I had an opportunity to do cranial surgery, various brain operations, spinal cord procedures that I had not done before. Well, from there, I went to Yale, because it seemed advisable to get some experience in purely basic research. And at that time, John Fulton at Yale had set up a primate laboratory, a laboratory in which he had primates from orangutans down to pottles, with a tremendous colony of monkeys. He got these from Africa. They were brought over by Treflish in boats that otherwise would be relatively empty. The mortality of these monkeys coming over from Africa to New York was terrific, but nevertheless, we got some monkeys from them, and Dr. Fulton had these in his laboratory. So that he was interested in the motor system, in the neuromechanisms of movement, fine movements, the muscle tone and so forth. In fact, he had just finished working on a large manuscript from Sherrington's lab in Oxford, and accordingly was interested in the motor system in monkeys. And so we repeated the experiments which Ferrier, 40 years previously, had carried out on the motor cortex, but with the knowledge that there were different areas of the cerebral cortex. The gigantopyramidal area of the motor cortex just in front of the central sulcus, the postcentral area, the temporal and the parietal lobes, and the prefrontal areas. And in the laboratory were a number of psychologists who had the best techniques for demonstrating deficits in motor function, in sensory function, and in other aspects of control by the brain of movement. Carlisle Jacobson, Ted Rue, and a number of other people. There's one chap there was interested in taste, for example. I was the only trained neurosurgeon at that time, so that these men were very happy to have me operate on their monkeys. I was lucky, apparently, and I didn't lose any of their highly trained animals, so that I would operate on animals that Dr. Rue was going to study the parietal lobe function, and Carlisle Jacobson was going to study the function of the medial thalamic nucleus, and other people were studying other aspects of cortical physiology. Well, this worked out very well for me. I had been working on the thalamus and studying the retrograde cell degeneration, so that I made a bargain with these psychologists that I would operate on their animals, and they could follow them and so forth, but when they were through with it, that I would have the brain to study the lesion and the thalamic degeneration. And in that way, I got, it must have been 30 or 40 monkeys' brains that had discrete lesions of various parts of the cortex, occasionally of subcortical structures. And since Dr. Fulton had no one in the lab interested in neuroanatomy, he was very happy to let me have these brains, and I took them with me over to Amsterdam. Spent 6-7 months with Professor Brouwer, who very kindly gave me practically the run of his laboratory. He had a technician, but she was working for him, but I could do anything else I wanted in there to prepare these brains. So I spent that 6 months preparing these various brains. Professor Brouwer was an interesting person. He was I could say about a 6-foot Dutchman, rather burly. When you first saw him, it kind of took you back. But when you got to know him, he was very kind. And I enjoyed my time in his laboratory. Alone, he would be quite informal. But when he was with other people, the academic community, he was very formal. And it just so happened that he liked to play golf. And he found out that I played golf occasionally. I couldn't play very well, but nevertheless, here was a partner for his golf game. So each Saturday noon, about 11 o'clock, he would come into the lab. He'd say, now, Dr. Walker, this afternoon we will go to Hilversum and play golf. Not by your leave, or would you like to? We will go. I will pick you up at 1 o'clock. And at 1 o'clock, he would pick me up, and we would go up and play golf that day. And this went on. The trouble was that he took me out too often, that my golf game improved considerably, and his did not. So that towards the end of my term there, I was playing better golf than he was, and he didn't like that. However, I enjoyed my stay in Amsterdam very much. I didn't speak the language, but most Dutchmen spoke 3 or 4 languages, including English, and consequently I got along very well. Well, from there I went to Brussels. I'd wanted to get some different types of neurophysiology, and at that time the electrical activity of the brain was just being studied and recorded. And Professor Frederick Bremer at Brussels had done some studies. You may have heard of Bremer. Bremer was the chap who cut the mesencephalon across and studied the encephalia soleil, or cut the upper cervical cord and studied the cervix soleil. He was very much interested in that because he developed a theory of sleep and of consciousness. Well, I went to see Professor Bremer, and he agreed to let me work in his laboratory. So I spent the last 6 months with him. There again, I had practically the run of the laboratory. There was 1 or 2 people there at times. Professor Bremer had his private practice, and he would come down to the laboratory maybe 10 o'clock in the morning and work until 1 o'clock, and then see patients all afternoon. He apparently was not a neurosurgeon and did not have a tremendously good technique. As a matter of fact, after I had been working with the Diener on some of my animals, the Diener came over to me and said, "You know, doctor, your animals aren't in very good condition." Well, why? What? Well, he says, your animals don't bleed like the professor's. Well, I enjoyed my time there. I was doing a little project on the relationship of the cerebellum and the motor cortex, and demonstrated that stimulation of the cerebellum or of the motor cortex would stimulate the other area. And then from there, I came back to Chicago. So I had an opportunity of meeting a number of very interesting people in the basic sciences.
Well, I think that's very impressive, and in a way, it's no wonder to me. Gradually, I understand that when I came to Johns Hopkins, you are really trying to set up diagnostic special laboratory for special neurological evaluation. And I noticed that those days, most of practitioners is satisfied just doing neurological examination, routine neurological examination by using percussion hammers or cotton ball or safety pin, although very artistic, and it's I thought very beautiful, like a artist. But anyway, I thought you are unlike. You are different. You're looking for more precise testing to evaluate those neurological function. And listening what you have been said, I getting understand. But could you tell us about those your felt need of a more special testing, opening laboratories?
Well, when you came to Hopkins, I had come through this experience with the psychologists at Yale, and learned that there were methods of quantifying neurological activity. And it seemed to me that if one was to carry out good scientific work, that one should be able to quantify the procedures. And so when I learned that you were interested in some of these techniques that could be used to quantify neural activity, and Dr. Tanaka told me that you had been well trained in surgery and knew something of the nervous system, it seemed to me that you might fit in with our plans and could set up a laboratory to quantify neurological activity. We call it a neurometrics lab, as you probably recall. Mm-hmm. And I think it has proved to be very valuable to the hospital and to the clinicians who otherwise would not have any means of being able to quantify in objective terms what the nervous system was doing.
Mm-hmm. I see. I'd like to go move to some little different aspect since when I came here and I thought that you have many trainees from other country. And could you tell that what's your experience with them?
Which?
With your experience with the foreign graduate student came to your training.
Well, I felt when I came to Hopkins that neurosurgery was getting a very considerable number of well-trained clinical neurosurgeons, and that what we needed were men who would advance the field of neurosurgery by being able to apply principles of basic science, basic neurology, basic anatomy, physiology, and so forth. And so I wanted to have in our team people who were interested in developing more scientific approaches to neurology and neurosurgery. Fortunately, we had Dr. Curtis Marshall with us, who came from Chicago, and he was able to do a lot in the field of electroencephalography. But there were techniques that could be used in other fields that I thought should be applied in neurology and neurosurgery. So I was interested in people from other parts of the world who might be able to bring some of that knowledge to bear upon our problems.
Mm-hmm. Well, sort of, I'm afraid to ask you, but why you selected me in that very, to me, very sophisticated group?
Well,
I'd like to just hear.
As I said, I had you highly recommended by Dr. Tanaka, who was your preceptor, I believe, in Centeno, and I thought that you had the skills to apply some of the techniques that you had been using to our neurosurgical problems. And consequently, as you developed your skills in neurosurgery, you would develop these other neurometric techniques.
Thank you, really. I feel grateful about that. Furthermore, I really fortunate to be one of your students. But I getting wonder, on the other hand, that future possibility of neurosurgical training for a student from abroad. I think might, like other students, seek, like I did 20 years ago, to get in training program. What the possibility do you think?
Well, you came at a time when we did not have too many people who were going into postgraduate studies in medicine. Since then, there have been many more people, so that some fields are said to be overcrowded. Neurosurgery is one of those. We, back in the 30s and 40s, had one neurosurgeon per 100,000 people, the general population. But after the war, with the great influx of people into the specialties, particularly neurosurgery and cardiac surgery, it looked as if we had as many neurosurgeons as we could really utilize. You see, a neurosurgeon, for example, if he is going to be able to operate upon the brain, has to be operating a certain number of times a week or a month. Mm-hmm. Otherwise, his skills deteriorate. Well, in the United States, there are only a certain number of brain tumors. We calculated a few years ago, perhaps there would be 17 or 18,000 brain tumors in the United States. Now, if there are 2,000, let's say, neurosurgeons operating, that means that there are only 8 or 9 brain tumors per year per neurosurgeon, which is hardly enough to keep that individual's skill at its height. So that we began to be worried about the training of neurosurgeons. And for that reason, the thought was that there should be a limit to the number of new neurosurgeons that would be taken in. Well, one way of remedying the situation for the individual hospitals who needed the help of the trainees was to bring people in from other countries. And so back in those days, we had quite a number of people who came from other parts of the world. We had people came from Thailand, for example, from South America, from Europe. And they would spend a short time with us and then go back to their country, which seemed to me to be a very satisfactory solution to the problem of oversaturation in the United States. Fortunately, we had some arrangements with neurosurgeons in other parts of the world to have their men come over for a time for specialized training. For example, we had an arrangement with Guy's Hospital in London so that Murray Faulkner's residents could come over to work with us for 6 months or a year. And these were well-trained people, but they were not acquainted with some aspects of neurosurgery that we could supply them with. Mm-hmm. And so they were very happy to come over at that time. The same thing applied with people from other parts of the world. South America, we had a number of people who came up for that type of training, and they would go back and practice in their native lands.
Right. As you just stated that you have so many foreign graduate trainees in your program, and looking back, all of those people who trained you admire you so much, but also the reason is you took care of them, really spent the time and devoted them. For example, I remember that when I walked into your office, this is also other student tells me, you always welcome us with a smile, and then you really listen. May you have not say a word until we finish. And then you might ask a few questions, and then typically, I really remember that impressed me, you close your eyes and often do like this. And I know you are listening and you are actually thinking. You are thinking. That's different from other people that I'm referring to those who cannot speak English well. So usually we get answer is a kind of reflex response from others. but you are the one listen, intensely listen, close your eye, and you thinking, and then when you open your eye, you give us answers. And that answer usually very short, but very positive one. I think that type of style impressed many of these foreign students came here and went back.
Well, Dr. Uematsu, you see, I have always thought that a professor at the university's primary purpose was to teach his students, his associates, and to do some research as well. And consequently, when you would come in with a problem, that was really my primary purpose, to help you resolve that problem. Not necessarily to resolve it for you, but to help you so that you could resolve it. And I think that is the essence and the purpose of a university professor. Is quite different to a person who's out in private practice.
I think that's also to tell what I felt, and also my friends tells me that you are like our father. They felt your father figure, so that I'm not the one felt that way. And you remember about, I think, 5 years ago, Japanese neurosurgeon gave you your 77th birthday. That's impressed to me. They give you that birthday went for 2 days. Now I'm part of the responsible on that birthday, but I had no problem everyone to make a birthday for 2 days. Now I'm a little guy. Particularly I go back to Japan, maybe some people don't know me, but when I approached to these people, my friend, from there, within a month, that's more than 200 people came and have a birthday. Now, I'd like to hear your also some feeling about it.
Dr. Uematsu, I appreciated that very much. As I have said previously, I've always considered that it was the aim and the goal of a university professor to help other people attain the goals that they wish to work for. And I don't know that I've been able to do that, but nevertheless, that's been my aim. And I think that a university professor should be working for his associates and his pupils, much more than for himself.
Well, actually beyond that, I heard about you are also spent training minority, so-called minority in this country or even other country, even when you're in Chicago in 1930s. Could you tell me about that? I have not heard too much of, but this is the first time I hear from you in more detail.
Well, I was brought up in Canada where there was really no thought of minorities, and it wasn't until I came over to the States that I realized that there was a rather sharp schism between the North and the South. At the University of Chicago, for example, we would go over to Providence Hospital, which was a hospital for the colored people, and act as consultants. This was done, I think, once a month. And then there were no neurosurgeons or neurologists over there, and so they asked me if we would take a well-trained surgeon from their hospital and give them some training in neurology at the University of Chicago clinics. Well, this posed a bit of a problem. There had never been a colored doctor at the University of Chicago clinics. And although I was perfectly agreeable to it, I went to the professor of surgery, Dr. Femister, and I told him the situation. And I said, now, if I take this chap on the staff for training, it may cause repercussions. Are you going to stick up for me? Well, he said, yes, yes, we'll do that. He consulted some other people. And so this chap came over on the service, and we had a couple people from the South who were there. And I remember the first day when this chap came in the office, and I introduced him to these two residents, that their faces kind of dropped. And later on, they told me, when one chap told me that his father came from the South, and that if he knew that he had shaken hands with a Negro, he'd die. But things worked out. I talked to the residents, and I explained that this man needed training, that they needed a neurosurgeon at the Provident Hospital, and that we were going to give it to him, and that they would have to do as much as they could to help. And I also talked to the chap himself, and I told him what the situation was. And he said he understood, and that he would act accordingly. Well, things worked out perfectly all right. There was no problem. So that is an example of the type of relationship that I've had with people from other countries, other races, and other nationalities. And I think if the situation is faced squarely, that it usually works out all right.
I really thought that some of scientists sometimes lacks of that sort of a humanistic aspect, but you have shown it's committed this humanistic aspect in the 1930s to help minority person or something. I think sort of incredible. I think that's, being we know you are human being and have a warm heart, devotion. Also, I have been very impressed. Took some years, but you are deeply committed to the scientific integrity, and also you have the ability to analyze things without bias. You can analyze things independently from those feelings, thought. Is this kind of thing you are developed, or you're born with it, or you are influenced by those many influential personalities you mentioned?
Well, I think that my reactions to other people stem from my upbringing in Canada. People in Western Canada are very open. They're friendly, and they accept other folks as friends and neighbors, and there's never any question. For example, in Eddington, we never locked our doors. Our doors were always open, and there was never any question. So that I had the feeling there that the other people were our friends and that we ought to help them. Mm-hmm. People who are in a pioneering countries and a pioneering situation do come to rely upon other people, and I think they have a little different feeling than people who are brought up in a city where there is a mass and a lot of conflict between mm-hmm. individuals.
Mm-hmm. How about this, your aspect of scientific integrity or power or strength? You could analyze things independently or objectively. How you develop on those things?
I'm not sure that I understand.
That you're able to, what I observed, for example, myself, when I'm writing paper or manuscript, I tend to get influenced by the same data there, but sometimes influence. That's what I'm trying to get into the strengths of your scientific integrity, to able to analyze things without influence too much of the feeling. You are able to stick on the fact of the research data, whatever we have.
Well, Dr. Uematsu, I think that comes from experience and from training. After a time, you realize that there are certain rules and certain regulations that have to be observed and that you have to follow. And as time goes on and you acquire experience, they become more or less second nature.
I see. Well, I think that's lots of things to learn at this day, and I think any scientist or involved in medical field, I think one of the key things. It's sort of a time is pressing here. I really like to acknowledge that's our appreciation. I'm talking on behalf of the foreign graduate trained by you and all those friends, that we really thank you that you trained us to being a neurosurgeon of today, and thanks again.
Well, you are very kind.
Well,
I'm very proud of you.
Well, really
Thank you.
great.